Immunology Cancer. Cancer is a large group of diseases that is characterized by uncontrolled growth and spread of abnormal cells. And there's more than 200 diseases that are classified as cancer. Cancer is not always a death sentence. More than 9 million Americans with a history of cancer are alive today, and some cancers can even be prevented. But definitely, early diagnosis can make a significant difference in survival or prolongation of lives of cancer patients. Cells that produce abnormally and in an uncontrolled manner form neoplasms or tumors. Now, tumors can be benign or malignant. Benign tumors are relatively harmless, but they can become problematic, especially in areas where space is limited and confined, such as within the skull. Malignant tumors can press on normal tissues and compete with normal cells for nutrients. They, of course, are more threatening because they can invade nearby tissues or colonize distant parts of the body. Regional invasion is the spreading of cancer cells into adjoining tissue. And metastasis is the term that we use when cancer spreads to distant areas of the body. The most common areas for metastasis are the liver, brain, bone, and lungs. Malignant transformation, we have factors that promote the transformation of normal cells to malignant cells, and those are increasing age, diet, hormones, and chronic irritation. A person's general emotional and physical health can also be factors in promoting or slowing the growth of cancer cells. These malignant transformations occur when normal cells are exposed to carcinogens that damage DNA and stimulate the initial change of normal cells, and that makes them more susceptible to malignant changes. Tumors are classified by the anatomic site, stage, and cell appearance and differentiation, which refers to how cells are different from the parent cells. When it's difficult to recognize the original type of tissue from which tumor cells come from, they're described as poorly differentiated cells. When cells are well differentiated, the tissue of origin is recognizable. When we talk about the suffix oma, O-M-A, that refers to a tumor, which is actually a swelling. Tumors are named according to the type of tissue where they originate from. Staging is done at the time of diagnosis and at intervals during and after treatment. Such staging is helpful in planning treatments and in predicting long-term survival. There's multiple methods of staging, and one method of staging is to use the TNM scale, or the Tumor Regional Lymph Nodes and Distant Metastasis scale. There's no one specific cause of cancer, but many things can increase the risk of cancer development. Some of them are genetic and environmental. Changes in genetic information of a normal cell can cause alterations that can lead to malignancies. Carcinogens can be affected or can have an effect, as can drugs, familial cancers, and hereditary cancers. And other factors that are thought to be associated with cancer development, again, are increasing age, hereditary, and hormones. The American Cancer Society has identified 7 warning signs associated with many common types of cancer. This guides the nurse and the public in identifying signs and symptoms that require medical evaluation. The first letters of the warning signs spell out the word caution, making it easier to remember them. Change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in a breast or elsewhere, indigestion or difficulty swallowing, an obvious change in a wart or mole, and nagging cough or hoarseness. Now, a number of things can be done to decrease the risk of cancer development and or detect it in the early stages. Many behaviors associated with good health can reduce the risk of some cancers. That would include a healthy diet, a balanced program of activity and rest, and normal body weight. Public education has focused attention on carcinogens, and people are becoming more aware of the need to avoid them. Identifying those who are at risk for development of certain cancers may be monitored more closely. Educating the public on screening techniques, warning signs, self-examination techniques, and the need for periodic cancer examinations are also helpful. The health history and physical examination often provide the first clues as to the presence of cancer. Diagnostic procedures may be used when cancer is suspected, when high-risk people are screened, or when determining the extent of a known disease. Procedures can include tissue examinations, imaging studies, endoscopic procedures, and laboratory tests. Combinations of procedures may be indicated for cancers that are difficult to locate or to determine whether there is more than one site. One therapy or a combination of therapies might be recommended depending on the type and location of cancers. Surgery. This is often performed in the majority of patients to diagnose and stage the cancer, to relieve symptoms, maintain function, sometimes to effect a cure, or to reconstruct affected structures. Surgery may also be done prophylactically in people that have a strong family history of a certain cancer. In other words, for example, some women have a really strong history of breast cancer in their family, and some women will choose to have a mastectomy or bilateral mastectomy to reduce the incidence. Surgery is often used with other treatments and is more likely to be curative when tumors are detected early, they're slow growing, they're confined to one area, or do not evade vital body structures. Adjuvant and neoadjuvant therapies are relatively recent approaches to cancer treatment. The adjuvant therapy may be used when a patient has had surgery or radiotherapy and is free of signs of disease, but they have a high likelihood of recurrence. Neoadjuvant therapy uses chemotherapy to reduce the extent of the tumor prior to surgery or radiotherapy. Radiotherapy is the use of ionizing radiation that's used in the treatment of disease. It treats cancer because malignant cells are more sensitive than normal cells to radiation, and we see immediate and delayed effects on these cells. Radiotherapy can be given internally, which requires the introduction of the radioactive substance into the body, or externally, which is given by the way of a beam that's directed at the tumor. When patients are receiving internal radiation, we really have to be careful of caregiver safety. And depending on the administration of that radiotherapy, visitors may need to be restricted to avoid contamination. Side effects of radiotherapy are usually not evident until at least a week after treatments are started, and they include bone marrow suppression, alopecia, anorexia, dry mouth, harm to reproductive cells, and developing fetuses or embryos. Chemotherapy is the use of chemical agents to treat disease by attacking cells at different stages of development. It is administered by a physician or a nurse who has had specialized education, either in an outpatient or an inpatient setting. Chemotherapy can be given orally, intramuscularly, intravenously, via intracavity, or intrathecal. Side effects of antineoplastic drugs. These act on both normal cells and malignant cells, and the side effects are very similar to those with radiotherapy. Patients who are at risk for toxic effects to the heart, lungs, nerve tissue, kidneys, and bladder. Although bone marrow suppression is the most dangerous side effect, nausea and vomiting are likely to be the most distressing. We can also see neurotoxic and hypersensitivity reactions with chemotherapy. And anti-neoplastic agents can also cause very serious tissue injury to the vein area during administration, especially if there's an extravasation or a leaking of the chemotherapy agent into the tissues. With biotherapy, this stimulates the body's natural defenses because it may help destroy malignant cells. Hematopoietic growth factors would include the colony-stimulating factors that stimulate the bone marrow to produce platelets, red and white blood cells. Biologic response modifiers, or BRMs, are intended to boost the body's existing defenses, and it acts directly on malignant cells or stimulates the immune system to act against them. And monoclonal antibodies are specific for proteins on the surface of certain cancer cells. The most common side effects of BRMs are extreme fatigue, headache, muscle aches, chills, and fever. We may also see bone marrow and stem cell replacement. With bone marrow transplantation, this is used after the treatment of leukemia and lymphomas with chemotherapy and/or radiation, and it destroys bone marrow. With the stem cell transplantation, it treats the destruction of the bone marrow that is caused by chemotherapy and radiotherapy. The transplantation of bone marrow or peripheral blood stem cells restores the blood manufacturing cells in a patient. If a patient donates his or her own stem cells or bone marrow prior to therapy, it's classified as an autologous transplant. Hormone therapy. There's various treatments to suppress natural hormone secretion, block hormone actions, or provide supplemental hormones. These hormones may be used to block the male sex hormones in the treatment of prostate cancer and female hormones in the treatment of breast cancer. Some non-traditional treatments would include relaxation techniques, guided imagery, music, meditation, herbal remedies, and acupuncture. Complementary therapy would include non-traditional therapy that is used with conventional therapy. And alternative therapy is the use of non-traditional therapies in the place of traditional treatments. Research is being conducted by the National Center for Complementary and Alternative Medicine in the National Institutes of Health to help determine the therapeutic value of non-traditional therapies. Unproven methods of cancer treatment. The American Cancer Society discourages treatments that have not been studied and found to be safe or effective. Alternative therapies can be harmful and they can delay treatment with potentially effective conventional treatments. And studies have found that 6% to 9% of patients with cancer admit to using some questionable method of cancer treatment. Regardless of the treatment, be aware of the side effects. Be sensitive to the disease and the disease process to include the mental status of the patient and family, and provide accurate patient education. This allows the patient to know what to expect. If the outcome of treatment appears to be a cure, of course the patient and family are going to be overjoyed. But some patients can become excessively concerned with their bodies and they're constantly looking for new evidence of cancer. Periodic checkups are essential, but they might be dreaded because the patient realizes that complete or permanent recovery is not always guaranteed. As patients recover from the effects of cancer and cancer therapy, rehabilitation might be required to restore them to the highest possible level of functioning. Although increasing numbers of people are surviving cancer, it is still the second leading cause of death. If treatment is unsuccessful, patients begin to decline. Provide information about home health care, hospice, and voluntary and charitable organizations whose services might be needed. For patients who wish to die at home, hospice is an amazing organization that helps provide support and teaching. Their focus is to keep the patient comfortable. They keep the patient's symptoms, especially their pain, under control during the final period of illness. And it provides bereavement care for the family after the patient's death. Conditions sometimes develop that require emergency intervention, such as a result of the disease process or therapy. Examples would include hypercalcemia, syndrome of inappropriate antidiuretic hormone, disseminated intravascular coagulation or DIC, superior vena cava syndrome, and spinal cord compression.